Ever wondered when the right time to introduce solids to your baby is? This question puzzles many, and understandably so. It's a significant milestone that marks the beginning of a new chapter in your little one's life. The general consensus among pediatricians is that babies are typically ready for solids around the 6-month mark. However, it's essential to remember that every child is different, and this timeline may vary slightly. So how do you know when it's the right time to start introducing solids? Well, there are a few telltale signs you can look for. Firstly, your baby might start showing interest in your food. Maybe they're reaching out for your plate, or perhaps they're watching you eat with keen interest. This curiosity is often a sign that they're ready to explore beyond breast milk or formula. Secondly, the ability to sit up unsupported is a crucial milestone that indicates readiness for solid food. This skill is important because it helps prevent choking. If your baby can sit up straight in a high chair, they're likely ready for the next step. Thirdly, the loss of the tongue thrust reflex is another indicator. You see, babies are born with a natural reflex to push food out of their mouth with their tongue. This reflex helps protect them from choking. But as they grow, this reflex gradually disappears, enabling them to swallow food. If your baby no longer pushes food out with their tongue, it's a sign they're ready for solids. While these signs generally indicate readiness, it's always a good idea to consult with your pediatrician before making the transition. They can provide personalized advice based on your baby's development and nutritional needs. So remember, every child is unique, so these signs may appear slightly earlier or later for your baby. It's all about observing, understanding, and responding to your baby's cues. After all, they're embarking on a new gastronomic adventure, and you're their guide. Now that you know when to start, how do you prepare for this new phase? Let's delve into that. The first step is to ensure you're creating a calm, distraction-free feeding environment. Remember, this is a completely new experience for your little one. It's normal for them to feel apprehensive, so it's crucial that the environment is as conducive as possible to this new adventure. Imagine you're trying out a new cuisine for the first time. You'd want to be in a relaxed setting, free from distractions, to fully appreciate and understand the new flavors, right? The same goes for your baby. Keeping the environment calm and quiet will allow them to focus on the new sensation of eating solids and will help you both to navigate this new territory together. Now let's talk about the types of food to introduce first. You've got a myriad of options, but it's best to start simple. Pureed fruits and vegetables are a great first choice. Think about soft, easy to digest options like sweet potatoes, apples, bananas, or peas. These foods are not only nutritious, but also have a mild flavor that won't overwhelm your baby's taste buds. Baby cereal is another excellent option. It's usually fortified with iron, which is a nutrient that babies need as they start transitioning to solid foods. You can mix it with breast milk or formula to create a familiar taste for your baby. One crucial tip to remember is to introduce one food at a time. This approach is not only to let your baby get accustomed to the taste and texture, but also to help you monitor for any potential allergic reactions. If you introduce multiple foods at once and your baby has a reaction, it'll be difficult to pinpoint which food caused it. Finally, be patient and persistent. Your baby might not take to solids right away, and that's okay. It's a learning process for both of you. With the right environment and food choices, the transition to solids can be a smooth one. So let's take this journey one spoonful at a time, and before you know it, your baby will be a little foodie, exploring the world of flavors with curiosity and joy. Introducing solids is an art. Want to know how to master it? Well, let's dive right in. Starting small is the mantra. You don't want to overwhelm your little one's digestive system. So begin with small amounts of solids, maybe a teaspoon or two, once a day. This can be during any mealtime that works best for your family's schedule. Gradually, over a few weeks, you can increase the amount and the frequency. Now, you might wonder, how do I know when to increase the quantity? Well, the answer lies in observing your baby. If they're finishing their small portion consistently without any discomfort, it's a good sign that they're ready for a little more. But remember, while you're introducing solids, it's important to continue breast milk or formula feeding. This is because breast milk or formula remains the primary source of nutrition for your baby until they're 1 year old. Solids at this stage are just a supplement to that. So don't worry if your baby is eating only small amounts of solids. It's more about getting used to the texture and taste at this point, rather than replacing their milk feeds. Now, let's talk about the pace of introducing solids. It's not a race, so no need to rush. Introducing a new food every 3 to 5 days is a good pace. This allows your baby to get used to one food before introducing another. And it also helps you spot any potential food allergies or intolerances. One more thing to remember, the transition to solids is more of a marathon than a sprint. It's a gradual process that takes time. So don't be disheartened if your baby isn't keen on solids right away. It can take a while for babies to get used to the idea of eating solids, and that's perfectly normal. Remember, patience is key during this transition. Your baby may not take to solids right away, and that's okay. After all, we're introducing them to a whole new world of tastes and textures. It's bound to take some time. So let's embrace this phase with a smile and a whole lot of patience. What if your baby rejects the food? Or what if they have an allergic reaction? These are common concerns that can make the process of introducing solids a daunting task. But fear not, with the right strategies, these hurdles can be overcome. Let's start with food rejection. It's important to remember that just like adults, babies have their own taste preferences. They might not take to a new food right away, and that's okay. Patience is key here. If your baby rejects a certain food, don't push it. Give it some time, then try reintroducing it later. It could take up to 10 tries before your baby starts accepting a new food. Another strategy is to mix the new food with something your baby already likes. For instance, if your baby enjoys sweet potatoes but rejects spinach, try adding a small amount of spinach to the sweet potatoes. Gradually increase the proportion of spinach until your baby becomes accustomed to its taste. Now let's address the most serious concern, allergies. Introducing a new food could potentially trigger an allergic reaction. Typical signs of an allergic reaction include rashes, vomiting, or difficulty breathing. If you notice any of these symptoms, it's important to seek medical help immediately. To minimize the risk of severe allergic reactions, it's recommended to introduce new foods one at a time and wait at least 3 days before introducing another. This way, if your baby does have an allergic reaction, it's easier to identify the culprit. Remember, the transition to solid foods is a journey, not a race. It's okay if your baby takes a little longer to accept new foods, or if they have a few bumps along the way. The most important thing is that both you and your baby are comfortable and happy during this process. Being prepared for these situations can help you navigate this new phase with ease. So, take a deep breath, stay patient, and enjoy this exciting new chapter in your little one's life. So, let's recap what we've learned today. Understanding when it's the right time to introduce solids is the first crucial step. It's generally around the 6-month mark. But remember, each baby is unique and may be ready at slightly different times. Look for signs of readiness, like maintaining a steady head, showing interest in what you're eating, and the ability to pick up objects and guide them to their mouth. Preparing for the transition is the next step. It's important to have the right tools on hand, like a high chair, baby-friendly utensils, and of course the food. Start with simple single-ingredient foods and gradually introduce more complex meals as your baby gets more comfortable with the concept of eating solids. Then we explored the art of introducing solids. It's not just about the food, it's about the experience. Make mealtime fun and engaging. Use different textures, colors, and flavors to stimulate your baby's senses. And remember, patience is key. It might take several tries before your baby accepts a new food, and that's perfectly normal. Dealing with food rejections and allergies is another aspect we've covered. If your baby refuses a certain food, don't give up. Try presenting it in a different way or mixing it with a food they like. Be vigilant for signs of food allergies, such as hives, vomiting, or difficulty breathing. If you suspect an allergy, consult your pediatrician immediately. Above all, remember that introducing solids is a gradual process. It's about getting your little one accustomed to a new way of eating, and it's okay if they don't take to it right away. Practice, patience, and perseverance will make the transition smoother. Remember, this is a journey for both you and your baby. Take it one step at a time, and before you know it, your little one will be enjoying a variety of foods. Happy feeding,